Welcome. I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. Let's start this off with the first lecture on pathology. Makes sense, right? In this image right here, we have a surgical pathologist looking at a glass slide that contains tissue. Highly likely that it's benign, but it could be malignant. We'll see a lot later on. This material is paired with a comprehensive book that tells you everything that you need to know about pathology to do well in coursework and on step 1. It's highly recommended that you have it as you go through these lectures, these videos, and through your medical education. What's pathology? Well, simply put, pathology is the study of disease. What you're going to need to know is that it involves understanding structural, functional, biochemical, and molecular alterations that occur in the diseased states at various levels, whether it be genetic, cellular, tissue, organ, and patient level. Now, there are two major branches of pathology. That's anatomic pathology and clinical pathology. Now, anatomic pathology is diagnosis of disease states from tissue specimens such as biopsies. And this also encompasses autopsy and forensic pathology. Imagine all the various types of surgical pathology. Imagine all the various types of surgeons. You have your head, neck, and thoracic surgeons, your trauma surgeons, your orthopedic surgeons. In general, there's a corresponding pathologist that assesses the specimens that a surgeon cuts out of a patient, cuts out of their patients. And each of these are examined, whether grossly, in person, just looking at it, or under a microscope to look for a microscopic disease, such as inflammation or cancer. Then we have clinical pathology. Clinical pathology encompasses all those tests that those busy first-year residents are ordering throughout the hospital, right? CBC, CMP, complete blood work, etc. Any test that you can think of, for the most part, within a hospital setting falls under the purview of clinical pathology. Even microbiology, if you want blood cultures or nasopharynx cultures, that goes to medical microbiology. And they actually create samples that are assessed for bacterial growth or fungal growth. We'll get into that more later. Then there's clinical chemistry, measuring blood gases or various compounds that might be found within an individual system, such as benzoylcoethylene. Now, technically, that falls under toxicology, which is a part of clinical chemistry, and definitely a part of clinical pathology. Even blood banking. Take, for example, you have that psychopathic surgeon blasting 80s rock music, not realizing that their patient's hemorrhaging, and then all of a sudden, "Doc, our patient's hemorrhaging." Quickly needs to get units of blood, stat. Well, that blood comes from the blood bank, which falls under the purview of pathology. They do various testing to make sure that the blood will be compatible with donors. I'm sure you've heard of A type, B type, O type blood, rhesus factor, and all that sorts of jazz. I'm here to tell you that there are many types of blood that you have not heard about. But for your purposes, it's good to know A, B, and O. We may get into that in later development. But for your purposes, you just need to know that blood banking falls under clinical pathology. I'll take that even a step further and say that transfusion medicine and apheresis falls under the purview of clinical pathology. Now, what is transfusion medicine and apheresis? Well, those are procedures or hospital components for transfusion. Usually it could be blood, sometimes it's plasma, sometimes it's IVIG. In either case, it's patient dependent. But take, for example, your sickle cell patients. You know that they may have sickle crises, have all sorts of joint pain and swelling. Well, to combat this, they receive blood transfusions from patients who don't have as much, hopefully none, sickling components in their blood. And that would fall under the purview of transfusion medicine. To master pathology, you need to have a strong grasp on these four things. That's the etiology of the condition, the pathogenesis, the histologic and morphologic changes that occur with certain pathologies, and the clinical manifestations. Now, regarding the etiology, you need to know if it's genetic or acquired and the mechanism by which it happens, the pathogenesis, what it looks like under a microscope or grossly sometimes, and definitely the clinical manifestations. So that takes us to the end of this first lecture. Quick one, very easy. We're going to keep these short, simple, full of information, only the information that you need, but all of the information that you need. We're going to make sure you do great. All right? Make sure you have the book. If you don't have the book, why didn't I see the book? We need to go back and check that. Either way, make sure you have the book that goes with these lectures. Check out the website too. There's so much useful information there. And it's very helpful on the fly when you're studying or being asked questions by professors, because that's going to happen whenever you're in the hospital, 3rd year, 4th year, and onward. So it's good to have resources handy. Start now. Because everything that you're being asked, let me be the first one to tell you that it comes up every single year. It comes up all the time when you're on the wards, when you're talking to patients. So make sure you have all of this information down packed. The more you know, the better you'll be. Till next time, see you later.